Hello, Cook County. This is Dr. Farchmin. I wanted to take the opportunity to show you what we talk about when we talk about PPE. That stands for Personal Protective Equipment. When it comes to COVID-19, it's what we use to protect healthcare workers and others from picking up the virus when taking care of somebody who is sick. I want to be really clear, this is what we use when we need to be in close contact with patients, when we're doing exams and cares for them. By doing all of the social distancing things, by washing your hands, you are protecting yourself adequately in the community. This is for when we are taking care of somebody who is very sick with COVID-19 that we need to be in close contact with, and how to do that safely. There's multiple layers of PPE. I'm going to show you the standard set. These are versions of some of them. There's lots of different versions out there, but they'll all have some similarities to this. We know that COVID-19 is spread through contact, on hands, on surfaces, so that's one layer of PPE. We also know that it's spread via droplets, which can be drops, but really what we are talking about when it comes to droplets, it's like the mist in your shower. These little particles can stay in the air for a period of time, kind of like fog in the air. It's those kind of particles that we're talking about when we say droplets. And so I'm going to put these on and show you the different elements. So the first thing that we put on is the gown, and that's to protect our clothing and our bodies from contact in case we come into contact with something or someone that has COVID-19 on it. And it's just a simple gown. Like most of the things that I'm going to be putting on, these are meant to be disposable, so that if there is any virus on these components, that we throw them away. That's the safest thing to do. Of course, our resources right now are limited, as I'm sure you're knowing, and so some of these things we're needing to be getting creative with. So that is the gown. There are various masks out there, but I'm sure the one you've heard most about is the N95, and this is the N95 mask. You can see it's pretty basic in its concept, and like the gown, it's designed to be used once and thrown away. We are needing to think of ways where we may need to reuse these if we do run out. It does have the filtration material in it, but more importantly, it's fitted. There are various sizes of these, and they're fitted to each specific individual because it needs to make a seal around the face. If that seal isn't there, it doesn't do what it needs to. And so the masks are simply put on like this. And then you need to do a check and make sure that it fits. Over this goes the face shield. This is to protect from any droplets that may come in contact with the face through coughing or sneezing or something like that. And last but not least are the gloves, which are pretty self-explanatory. So, if you have COVID-19 and you need to be seen in the clinic, this is what we will look like. This is much different than you're used to, but it is what we need to do to keep ourselves safe. Now, at the end of the visit, we take all of our PPE off. And underneath it all, we are still the providers that you know. We do not want to wear these. It pains us to have to wear these, but we want to make you aware that this is what we do to keep ourselves safe and healthy so that we can be here to continue taking care of you and to take care of the patients that come after you. We look forward to the day when we don't need to wear this, but I wanted to make it very clear that when we are wearing these, it's because we want to be available to keep taking care of you and your loved ones and the other people of this community. We are not afraid of you. This is simply what we do to keep ourselves and the community safe. So I hope this has been helpful to show you what we mean when we talk about PPE. We hope to keep sending out good and accurate information into the community. Remember, get your sources from good places like the CDC, Minnesota Department of Health, and the Johns Hopkins website. We're here for you and look forward to seeing you in the clinic.